Okay, so there's this story circulating all over social media today about Mbappe and how they imaged his wrong knee, sent him back out to play, and it is all over the place. Hey, I'm Dr. Durrani, I'm a board certified emergency medicine physician, and I'm calling BS on this story. There are way too many sketchy things going on here. First of all, they're saying that they imaged his wrong knee. Obviously, that was apparently the healthy knee, and they sent him back out to play because everything looked good there. I'm not sure if you've ever gotten an MRI, but when you get an MRI, they put a little coil around the part of the body that's being imaged. So if we're talking about, say, his right knee was the injured knee and getting imaged, it would have a coil around it before he went in and out through the MRI machine. Now, either he was completely checked out to the point that he didn't notice that they put the coil around the wrong knee, or I'm calling BS, and I think it's that. And when we're talking about an athlete worth hundreds of millions, when his contract is hundreds of millions of dollars, he is not going to these appointments alone, right? He's probably got his agent, his doctor, his PT, a variety of other folks going there with him. In addition to that, as an ER doctor, I do a bunch of procedures. We send patients for imaging, all kinds of stuff. And we, not one, not two, not three, triple, quadruple check what part of the body we're doing something on. So if we are doing a procedure, for example, we'll call out timeout, and myself, a nurse, a third individual will confirm that, hey, maybe we're performing a shoulder reduction, that it's on the right side of the body. Everyone will go through that. We'll confirm the patient's name, the date of birth, all types of stuff. And so there are numerous checks in place. Once again, this is for the average person. Now, I'm not saying that the average person receives subpar care compared to a multi-$100 million athlete, but let's face it, they get a little extra attention. So I imagine there is even more extra checks in place for folks like that. In addition to that, his statement was very political in that he released that he had to go to Paris, where his former team was, to get the correct diagnosis. That's kind of, a little hint at some animosity between where he's at currently and maybe where he went to get the imaging. But, back to the original point, I simply do not believe this story. I think there is an ulterior motive. When you look at this particular team, Real Madrid's medical staff, there has been a lot of speculation around how good they are. A bunch of them were actually let go back in January. There has been a lot of injuries when it comes to the team that have been blamed on how quickly players have returned. And I think this was the probably final straw that led them to, release a bunch of players. Do I truly believe that he had the wrong knee image, that it looked healthy, and they sent him back out to play solely based on that, and that he had no idea that the wrong knee was imaged, and none of his team did? I don't buy that. There's way too many checks in place. But let me know your thoughts. This is turning out to be an interesting story.